Welcome to our comprehensive guide on infection control precautions, a crucial topic for registered nurses preparing for the NCLEX. In this video, we'll break down the four main types of precautions: airborne, droplet, contact, and standard. We'll also share helpful mnemonics and highlight the most high-yield points you need to know for exam success. Understanding these precautions not only helps you ace the NCLEX, but also ensures patient and healthcare worker safety in real-world settings. Let's start by exploring why these precautions are so important and how they form the foundation of infection prevention in healthcare environments. Standard precautions are the basic level of infection control that should be used in the care of all patients, regardless of their diagnosis or presumed infection status. These precautions include hand hygiene, use of personal protective equipment like gloves and masks when necessary, safe injection practices, and proper handling of potentially contaminated equipment or surfaces. Standard precautions are the first line of defense and are always in place to prevent the spread of infection. Remember, these are applied to every patient, every time, and form the backbone of all other precaution types. Help you remember the key components of standard precautions. Use the mnemonic HANDY PPE, H for hand hygiene, P for personal protective equipment, P for proper disposal of sharps, and E for environmental cleaning. This simple phrase can help you recall the essential steps to protect yourself and your patients from infection. Mnemonics like this are especially useful for quick recall during the NCLEX and in clinical practice. Airborne precautions are used for diseases that can be transmitted through tiny droplets that remain suspended in the air. Examples include tuberculosis, measles, and varicella chickenpox. These precautions require the use of a negative pressure room and an N95 respirator mask for healthcare workers. Patients should be placed in a private room with the door closed, and only essential personnel should enter. Understanding when to implement airborne precautions is a high-yield topic for the NCLEX. Helpful mnemonic for remembering airborne diseases is "My chicken has TB." M for measles, C for chickenpox varicella, H for herpes zoster disseminated, and TB for tuberculosis. This phrase quickly brings to mind the key conditions that require airborne precautions, making it easier to answer related NCLEX questions. Droplet precautions are necessary for diseases spread by larger respiratory droplets, such as influenza, pertussis, and meningitis. These droplets do not travel far, usually less than 6 feet, so a surgical mask is sufficient for protection. Patients should be placed in a private room or cohorted with others with the same infection. Healthcare workers must wear a mask when within close proximity to the patient. This is a frequent topic on the NCLEX, especially regarding which diseases require droplet precautions. Remember diseases requiring droplet precautions. Use the mnemonic Spider-Man. S for sepsis, S for scarlet fever, S for streptococcal pharyngitis, P for parvovirus B19, P for pneumonia, I for influenza, D for diphtheria, E for epiglottitis, R for rubella, M for mumps, M for meningitis, A for adenovirus, and N for Neisseria meningitidis. This comprehensive list covers the most common droplet spread infections tested on the NCLEX. Contact precautions are used for infections that spread through direct or indirect contact with the patient or their environment. Common examples include MRSA, VRE, C. difficile, and scabies. Healthcare workers must wear gloves and gowns when entering the patient's room and remove them before leaving. Equipment should be dedicated to the patient or thoroughly disinfected after use. This is a high-yield area for the NCLEX, especially regarding which PPE is required and how to prevent cross-contamination. Mnemonic Mrs. Wee helps you remember the main conditions requiring contact precautions. M for MRSA, R for respiratory infections, S for skin infections, W for wound infections, E for enteric infections like C. diff, and E for eye infections, conjunctivitis. This tool is invaluable for quick recall during the NCLEX and in clinical settings. Knowing which personal protective equipment, PPE, to use for each type of precaution is a frequent NCLEX question. For airborne precautions, use an N95 respirator. For droplet, a surgical mask is sufficient. For contact, gloves and gowns are required. Standard precautions may involve gloves, masks, or gowns depending on the situation. Always remember to don and doff PPE correctly to avoid contamination. For airborne precautions, patients must be placed in a negative pressure room to prevent the spread of infectious particles. The room should have a dedicated ventilation system, and the door must remain closed at all times. Only essential personnel should enter, and they must wear N95 respirators. These details are often tested on the NCLEX, so make sure you're familiar with room setup and access protocol. Patients on droplet precautions should be placed in a private room, but if necessary, they can be cohorted with others who have the same infection. Healthcare workers must wear a surgical mask when within 6 feet of the patient. Visitors should also wear masks. These details are important for both patient safety and NCLEX preparation. For contact precautions, patients should be in a private room if possible. If not, cohorting with patients who have the same infection is acceptable. Healthcare workers must wear gloves and gowns, and all equipment should be dedicated to the patient or disinfected after use. These steps help prevent the spread of infection within healthcare settings. Hand hygiene is the single most important measure to prevent the spread of infections. Whether you're following standard, contact, droplet, or airborne precautions, always wash your hands before and after patient contact, after removing gloves, and after touching potentially contaminated surfaces. This is a foundational concept for both the NCLEX and safe nursing practice. Knowing the correct order for putting on personal protective equipment is crucial. The recommended sequence is gown first, then mask or respirator, followed by goggles or face shield, and finally gloves. This order helps ensure maximum protection and is a common NCLEX question. Equally important is knowing how to safely remove PPE to avoid contamination. The correct sequence is gloves first, then goggles or face shield, followed by gown, and finally mask or respirator. Always perform hand hygiene immediately after removing all PPE. This is a high-yield NCLEX topic. For patients with C. difficile, hand hygiene with soap and water is required because alcohol-based hand sanitizers are not effective. Use gloves and gowns and ensure thorough cleaning of the environment with sporicidal agents. This is a frequently tested detail on the NCLEX. Tuberculosis requires strict airborne precautions. Patients must wear a surgical mask if they need to leave their room for any reason. Healthcare workers must always use N95 respirators. These details are critical for both patient safety and NCLEX success. Influenza is spread by droplets, so droplet precautions are necessary. Healthcare workers and visitors should wear surgical masks, and patients should be isolated or cohorted. This is a common scenario on the NCLEX, so be sure to remember the appropriate precautions. MRSA is a common cause for contact precautions. Always use gloves and gowns and dedicate equipment to the patient if possible. Proper cleaning and disinfection are essential to prevent the spread of MRSA in healthcare settings. Varicella chickenpox requires both airborne and contact precautions. Patients should be isolated in a negative pressure room, and healthcare workers must wear N95 respirators, gloves, and gowns. This dual precaution is a high-yield point for the NCLEX. Meningitis, especially caused by Neisseria meningitidis, requires droplet precautions. Place the patient in a private room and ensure all staff and visitors wear surgical masks. This is a frequently tested infection control scenario on the NCLEX. Respiratory syncytial virus (RSV) requires both contact and droplet precautions. Healthcare workers should wear gloves, gowns, and masks. Equipment should be dedicated or disinfected after use. This dual approach is important for both patient safety and NCLEX questions. Scabies is a skin infestation that requires contact precautions. Healthcare workers must wear gloves and gowns, and all bedding and clothing should be thoroughly washed. This is a common infection control scenario on the NCLEX. Disseminated herpes zoster shingles requires both airborne and contact precautions. Patients should be isolated in a negative pressure room, and healthcare workers must use N95 respirators, gloves, and gowns. This dual precaution is a high-yield NCLEX topic. Adenovirus can require both contact and droplet precautions. Use gloves, gowns, and masks when caring for these patients. Equipment should be dedicated or disinfected after use. This is another dual precaution scenario to remember for the NCLEX. Vancomycin-resistant enterococcus (VRE) requires contact precautions. Use gloves and gowns and dedicate equipment to the patient if possible. Proper cleaning and disinfection are essential to prevent the spread of VRE in healthcare settings. Diphtheria is spread by droplets, so droplet precautions are necessary. Healthcare workers and visitors should wear surgical masks, and patients should be isolated or cohorted. This is a classic infection control scenario on the NCLEX. Rubella is another disease requiring droplet precautions. Place the patient in a private room and ensure all staff and visitors wear surgical masks. This is a frequently tested infection control scenario on the NCLEX. Mumps is transmitted via droplets, so droplet precautions are required. Healthcare workers and visitors should wear surgical masks, and patients should be isolated or cohorted. This is a common infection control scenario on the NCLEX. Parvovirus B19 is spread by droplets, so droplet precautions are needed. Healthcare workers and visitors should wear surgical masks, and patients should be isolated or cohorted. This is another infection control scenario to remember for the NCLEX. Scarlet fever is transmitted by droplets, so droplet precautions are necessary. Place the patient in a private room and ensure all staff and visitors wear surgical masks. This is a classic infection control scenario on the NCLEX. Streptococcal pharyngitis, also known as strep throat, is spread by droplets. Healthcare workers and visitors should wear surgical masks and patients should be isolated or cohorted. This is a common infection control scenario on the NCLEX. Epiglottitis is a serious infection spread by droplets. Droplet precautions are necessary with surgical masks for healthcare workers and visitors and isolation or cohorting for patients. This is a high-yield infection control scenario for the NCLEX. Certain types of pneumonia, especially those caused by bacteria like Neisseria meningitidis, require droplet precautions. Healthcare workers and visitors should wear surgical masks and patients should be isolated or cohorted. This is a frequent infection control scenario on the NCLEX. Enteric infections, such as those caused by C. difficile or norovirus, require contact precautions. Use gloves and gowns and ensure thorough cleaning of the environment. Hand hygiene with soap and water is essential, as alcohol-based sanitizers are ineffective against spores. Certain eye infections, such as conjunctivitis, require contact precautions. Healthcare workers must wear gloves and gowns, and all equipment should be dedicated or disinfected after use. This is a common infection control scenario on the NCLEX. Wound infections, especially those with uncontained drainage, require contact precautions. Use gloves and gowns and dedicate equipment to the patient if possible. Proper cleaning and disinfection are essential to prevent the spread of infection. Certain skin infections, such as impetigo or herpes simplex, require contact precautions. Healthcare workers must wear gloves and gowns, and all equipment should be dedicated or disinfected after use. This is a common infection control scenario on the NCLEX. Some respiratory infections, such as RSV and parainfluenza, require both contact and droplet precautions. Use gloves, gowns, and masks and dedicate equipment to the patient if possible. This dual approach is important for both patient safety and NCLEX questions. Sepsis, depending on the causative organism, may require droplet precautions. Healthcare workers and visitors should wear surgical masks and patients should be isolated or cohorted. This is a high-yield infection control scenario for the NCLEX. Pertussis, whooping cough, is spread by droplets, so droplet precautions are necessary. Healthcare workers and visitors should wear surgical masks and patients should be isolated or cohorted. This is a classic infection control scenario on the NCLEX. Pneumonic plague is spread by droplets, so droplet precautions are necessary. Healthcare workers and visitors should wear surgical masks and patients should be isolated or cohorted. This is a rare but important infection control scenario for the NCLEX. Let's review the key points. Standard precautions apply to all patients and include hand hygiene and PPE as needed. Airborne precautions require N95 masks and negative pressure rooms for diseases like TB and measles. Droplet precautions use surgical masks for infections like influenza and meningitis. Contact precautions require gloves and gowns for MRSA, VRE, and C. diff. Remember the mnemonics and high-yield details for each type, as these are frequently tested on the NCLEX. As you prepare for the NCLEX, focus on understanding when and how to apply each type of precaution, the correct use of PPE, and the key mnemonics. Practice scenario-based questions to reinforce your knowledge. Remember, infection control is not only vital for passing the exam but also for ensuring the safety of your patients and colleagues in clinical practice. Good luck on your journey to becoming a registered nurse.